Okay, I want to show my teeth when I smile. I want to buy apple.
Now this is a unique story. It's a unique story because this beautiful patient, we call her the girl from Brazil, she presented with partial loss of teeth, orofacial scarring, and the story goes like this. When she was about 1 or 2 years of age, she swallowed caustic soda accidentally, which burned her mouth. It destroyed most of the oral tissues. It destroyed most of her tongue. Her face, the scarring, we call it the oropharyngeal scarring, the whole mouth and the back of the throat all scarred. It was initially grafted with a skin graft. And from a childhood, her face failed to develop to like a normal face would otherwise. And so she can't open her mouth wide enough for us to even put a mirror and restore the back teeth, or even take a normal impressions. So in many ways, her lower facial half has failed to develop. In other words, everything has to develop except that the bone that's holding the teeth haven't developed, so her face is overclosed. From the initial images, as you can see, how her top and bottom teeth are angled inward, and this actually reduced the lip support, and she got beautiful lips, and also not they're angled inward, but the whole bite is closed. When you retrocline the teeth, and that's it's inwardly inclined within the facial frame, it reduces the important support for the lips. In other words, when your teeth are in this manner and your lip is out here, the whole lip collapses. As you move the teeth in their right position, it forms that nice lip support. By placing the upper and lower teeth in the correct position, it improves the whole lip outline. Now, in the orthodontics, there's a lot of data to support this, but data is one thing. The actual producing of the effect is another in clinical format. So clinically, the aim is to allow that formation of the tooth position to support the lips and the facial skeleton. At this young, beautiful age, she hasn't got that youthful appearance as a beautiful lady would otherwise. Because the teeth and the bone in the arches didn't develop properly, patient had a speech problem. And part of the treatment was also to improve the speech. And this was tested during the diagnostic mock-up stage.
Curious, my heart is beating so fast. Yes, I like it.
What do you think?
I can't stop smiling. I can't believe it.
It's the first time that you can see what can be done, correct?
Yeah.
And you're happy. I can see.
She's always been through lots of dentists and they never told her, okay, we can fix it. They always say like it's provisory or temporary.
This is the word they always hear. It's provisory, temporary.
We can do something for you, but you have to be patient with me.
I'm waiting 34 years.
You're on. That's what I want to hear. And that really moved me. It moved me so much that I said, well, you know what, we gotta get it right. In terms of, some case you expect to go, but this case was extraordinary case because I really want to have that, the look that I think I could possibly get in this case and help her. We spend a lot of time together. I spend a lot of time with my patients, but the girl from Brazil was very unique. And so we had to do diagnostic assessment, the mock-up, and you can see on the video how it changes patient. She was so happy, and it allowed us to get to know each other better. And I was able to do the things and ask her, I want to do this, I want to do this, we can do this. And we slowly developed the diagnosis that we felt was going to be the guiding the future smile look. Initially it involved doing orthodontics, it's just small adjustments using we call a PAOO, which is using small surgical incisions to be able to move the teeth a lot faster, which I normally do. In this particular case, we had to put special mini implants, we call them TADs, to be able to lift the upper teeth upwards, and so we can reduce the amount of the gum showing and allow me to open the bite a little bit more. It took about good 4 or 5 months using orthodontic movement. Once that was completed, we proceeded with small gum leveling to create symmetry. We also did another diagnostic mock-up to see how it looks. And then initially we want to do porcelain veneers and some treatments on the back teeth, and also place some implants on lower arch, etc., which can be done at a later stage. But initially we decided to use composite veneers for her, and we did some work on the lower arch as well. We opened the bite, improved the face, improved the lower lip, the small grooves that's present in, we call it mental groove. It was very deep, we made it a bit more feminine, we improved the jawline, and it's all done by dentistry. We created a profile which I thought was the best possible outcome for the patient. We not only corrected the position of the teeth, but we also, in reality, so rotate the arch to place symmetry and harmony in the face as well, and balance the face to create the effect, the final effect, as you can see, which I call the aesthetic effect, that creates a balance between the teeth, the gums, the lips, and the face. Every little thing that was planned initially finally had its input to the final aesthetic outcome. The patient's confident now. I think she looks beautiful. I took these pictures straight after the treatment.
My God.
It's so different. It's a big difference, seriously.
What do you think?
I cannot think, I just smile.
So she just smiles. She doesn't say anything. That's it. It's
My God. My mom and dad is gonna be crazy.
But when it comes to improving someone's dentofacial aesthetics and the difference that we made for this beautiful girl from Brazil, I'm just so happy that we were able to do it for her. We do need more treatment. Don't understand, it's not the end of the treatment, there's other things to be done. But at this stage, for now, I have restored hope, confidence, and a future. You happy?
Yes.
Huh? I know how you feel. It's been a long time. It's been a long time. Have you noticed there's no strain on the musculature when she's trying to smile? Okay, you can notice how she's exerting to smile. But now we've restored the facial height and all the right proportions. She can smile without strain and it looks so natural. Her lips, the outline, the contour, the support, the facial folds have all disappeared. We have made this patient look how she should look a long time ago, as appropriate to her young age, young and vital age. You know, the dentofacial rejuvenation takes many forms of treatment to achieve the desired outcome for this beautiful girl from Brazil.